Hi, nice to meet you.
Wash my hands and then sit down. Are you okay if I have a seat?
Of course, thank you.
So my name's Katie. I'm going to be your NP today doing your exam today for you. We're going to start off doing an abdominal exam, and then we're going to move to cardiac. I'm going to listen to your heart, take a look at your chest. Then we're going to move to peripheral vascular, which is just kind of like how your blood flow is. Sorry, that's my niece. And then, so we're going to take a look at your peripheral vasculature, which is, we're going to look at your arms and legs and how your blood flow is moving, and then we're going to look at your breathing and listen to your lungs, okay? So I am going to start off with having you lie flat, with your hands by your side.
Okay.
Have you recently gone pee also? Because we kind of
Yes.
want your bladder empty for this.
Yes.
Okay. All right. So with your abdominal assessment, I can tell with your shirt still down that your abdomen is flat, but I'm going to go ahead and have you lift your shirt up for me and kind of pull your pants down a little bit. So I'm going to start by just looking. I see that your abdomen is flat. There's no distension, no redness, no ulcers, no swelling or edema is present. And then I am going to start by listening. So I'm going to put my stethoscope on. Okay, I'm going to listen in all 4 quadrants with the big part of my stethoscope. It might be cold, I'm sorry. So now I'm just listening for your bowel sounds. Okay. You do have good bowel sounds. Your bowel sounds are hyperactive, loud gurgles. I'm just going to put your shirt down while I'm talking to you. Hyperactive, loud gurgling noises with your abdomen, and then I'm going to go back to looking at it. I'm going to kind of squat down at the side and at your feet just to make sure.
Okay.
So I'm just going to take a look here and then come down to your feet. And take a look from down here. Abdomen is flat, symmetrical. When your shirt was up, may I lift your shirt back?
Sure.
Okay. There's no like pulsations or any kind of peristalsis that is visible that I'm seeing here. So next I'm going to percuss with my finger. Just kind of tap, like put my finger down and tap pretty hard on it. But first, I'm going to listen with the small part. I'm going to listen to your aortic, your renal, your inguinal, and your femoral artery areas, okay?
Okay.
Once again, using this, so it might be a little bit cold, okay?
Okay, thank you. It's colder. Sorry.
I'm sorry.
It's okay.
And then your femoral is going to be kind of down here, okay?
Okay, thank you.
Lovely. No, so that was just listening to the vasculature of your abdomen, and I didn't hear any bruise, which is like just turbulent blood flow, no hums or rubs or anything. So you're looking great there.
Okay.
So now we're going to move on to the tapping part. I'm going to take my finger and tap on it just to kind of listen to the noises that your abdomen makes, okay?
Okay.
Once again, I'm going to lift your shirt up. Sorry, lots of belly action. All right.
I liked it.
Thanks. So I'm going to start and I'm going to listen in the 4 areas
Okay,
again,
thank you.
okay? Wonderful. It has a like a tympanic noise in all 4 quadrants, which is great. That's what you want to be heard. Now I am going to palpate the abdomen. I need you to prop your knees up for me, kind of, yep, just like that.
Okay.
And with this, I'm going to be palpating your abdomen again, and I just want you to tell me if there's any areas that hurt when I touch you.
Okay.
Or if you get any other pain in like your back, or if there's, when I touch you and it hurts somewhere else, let me know.
Okay.
Are you okay if I start touching?
Yep.
Okay.
Thank you.
So I'm palpating softly with the tips of my fingers first. Any pain?
No, none at all.
Nothing?
No pain.
Okay, I'm going to go a little deeper and I'm going to use both hands this
Okay,
time.
thank you. No pain.
Nothing?
Nope.
Okay.
No. No.
And when I press, does it hurt anywhere else?
No, it does not.
Okay, awesome. And then I'm going to also, I forgot to say that, but if this was a patient, I would put gloves on because I would not touch someone with my bare hands. Pretend that I have gloves on.
That's fair.
So I'm going to have you take a deep breath, and when you take a deep breath, I'm going to kind of press in under your ribs and
Okay.
have my hand behind on your side, okay?
Okay.
So take a deep breath for me. Besides tickling, does it hurt?
No, not at all.
That was for your liver. So
Okay.
now we're going to go over here and look at
Do I
your
need my legs
spleen.
up still?
Yes.
Okay.
And take a deep breath.
Okay.
Any pain?
No.
Just tickling?
Yes.
So no tenderness, no enlarged liver or spleen, no tenderness or rebound tenderness when I was palpating lightly and deeply in your abdomen.
Sorry, my back itches.
Nothing.
I interrupted you. I'm very sorry.
You're okay. Is your back itchiness okay?
Yes, I'm fine.
Okay.
Thank you.
So no pain like in your shoulder when I touch your ab, like palpating
No,
anywhere?
not at all.
Okay, so there's no rebound tenderness, there's no referred
Correct.
pain anywhere. Okay. I would also check like the Rovsing obturator sign. It's like and those are for appendicitis, which you currently are not experiencing.
Correct.
And then I would check the Murphy sign for gallbladder pain, which you are also not experiencing.
That is correct.
Which is great because that's horrible.
Yes.
So now that we have done your abdomen, we're going to move on to listening to your heart and going over your heart assessment, your cardiac assessment. Are you okay with that pillow?
Yes.
That does not look comfortable.
Oh, no, it's fine.
So starting with the cardiac assessment, I would take a look at your chest, your thorax, take a look at your neck. Your chest and thorax are symmetrical. There's no deformities noted. I'm not seeing any like vein distension or bulging, pulsating arteries in your neck. Now we are going to move on to feeling your arteries in your neck, and I'm going to do one at a time so that I don't make you pass out from blocking off blood flow to your brain. That's not good. We don't want to do that. There's also no heaves or lifts noted in your initial cardiac chest assessment, which is just some abnormalities that you would see in people with cardiac issues.
Okay.
So yeah, we're gonna start listening, or start with feeling first, and then I'm gonna go ahead and listen to your heart. When I listen to your heart, there's some different spaces that I'm gonna listen to. You have your aortic, which is here on the right side. Then you go to pulmonic over there on the left, and you have your Erb's point, your tricuspid, and your mitral. Your mitral is also like the PMI area, which I'm sorry, I'm feeling that right now.
That's no worries.
Just palpating that. But those are just different areas that we listen to, so we can see which part of the heart is what's going on in this certain part of the heart.
Okay.
Yeah. And to feel your PMI, I would palpate at the 5th intercostal space, mid-clavicular line, and that's that area down there.
Okay. Perfect.
So
do you want my legs up or down?
You can rest your legs now. I'm sorry.
No, you're okay.
So starting with your carotid pulses in your neck, I'm just going to feel one side at a time, okay? Just going to feel for that pulse and just kind of hold it there for a minute.
Don't apologize. You're good.
You not done, Sarah?
We're almost done. I'm getting close.
Okay.
And then I'm going to feel... Sorry, that's her husband.
I'm sorry.
And then I'm going to feel your other side, just doing one at a time here. So I'm going to use my other
That's okay.
Oh, Nora's back.
Per usual.
So your carotid pulses, you have a regular rate and rhythm. No masses. I didn't feel any masses or anything in your neck. Your amplitude is +2, which is normal. Everything is normal. Looks great there. Now I'm going to listen to your heart sounds with my big side, and then I'm going to go to my little side.
Okay. Thank you.
Little side now, okay?
Okay, thank you.
Once again, regular rate, rhythm, amplitude of +2, everything is normal, and you look amazing. Now I'm gonna move on to just kind of looking at your arms, and I'll just keep you laying down still, just since it's easier. So I'm gonna take your friend.
Do you want me to take this?
No, you're
Oh,
fine.
okay.
I can look up your
Yeah,
sleeve.
no worries.
So just taking a look at your arms, your vasculature, your capillary refill is great. Nails are pink, and let's look at both sides. Yep, great capillary refill. Pink nails, skin is intact, very warm, just like all of us in the Kearns family.
This is very true.
Skin is warm, intact. No lesions on either arms or legs. This is just psoriasis, this normal skin condition our family has. checking your toes, okay?
Sure.
Sorry, I know. Once again, would have gloves on because
That would be really gross.
yeah, I'm not touching someone's feet with my bare hands.
That's fair.
Great capillary refill in your feet. Toenails are pink. Even hair distribution up both legs. No varicose veins are noted. Also, do you have a history of varicose veins in your family?
I do.
We don't. So no
That'd be horrible.
varicose. Yeah. See, with nursing and you stand on your feet all day, I'm starting to get some on my thighs, I think, and it's terrifying.
That's not fun.
But no varicose veins. You lucked out. Even hair distribution. Not cyanotic anywhere. You good skin color. As well as up here on your arms. I'm just gonna take a look.
Okay, you're fine.
In here, yep. Great. Normally I would have you wear a t-shirt and do this, but it is cold outside. But still, great skin, no lesions or anything. So, now that I've looked at you, I'm going to listen to your pulses. You have your radial and your brachial in your arm, and then I'm going to kind of feel around for some lymph nodes in your arms. And then we're going to go down to your femoral, which are down here again, your popliteal back behind your knee, and then you have two in your feet. You have one at the top and then one kind of here on the side. I'm going to feel for those. And then I'm also going to feel for your lymph nodes up here, feel around for some lymph nodes. If you're all right if we start doing that?
Yep.
Okay. So I am going to assess your pulse, which feels wonderful. And then this, I will just kind of push that up just so I can. I'm just going to kind of bend your arm at an angle and feel that pulse in there, okay? And then I'm also feeling around for your lymph nodes, and I do not feel any lymph nodes, which is great. You don't want to feel them.
Oh, good.
All right. Same with over here. Just checking your pulses, which feel great. I'm going to bend that arm again at kind of a 90-degree angle, just like that. And then I'm just going to feel for your pulses in there. Once again, no lymph nodes that I can feel either. So down here, is there any way you could kind of pull your shorts just a little bit? Because I just don't want to. There we go. I'm just going to feel for your femoral pulses. And also while I'm here, I'm not feeling any lymph nodes anywhere. I'm going to do the same over there on that other side. And no lymph nodes there as well. Coming over here behind your knee. Sorry, it tickles. We're a very ticklish family, and she's trying not to die over here.
Sorry.
Great pulses there. As well as there. Tickle, tickle. I'm going to feel your pulses in the top of your foot. And then this one kind of by your ankle. I feel like I'm holding your foot. Great. Regular rate and rhythm +2 amplitude with the pulses in your feet, in your legs, arms. Your vasculature looks wonderful. I think you are the healthiest person I've ever seen.
Thank you very much.
You're welcome.
Thank you.
So now we're going to move on to respiratory. I'm going to have you sit up for this portion.
Okay.
Nora. Mom. Mama.
Constant.
Oh, I love her.
What? That's a big camera.
Also, just like I did, I think I already did it in your legs, but just feeling the skin. The skin of your legs is warm. No edema noted anywhere at all. So now we're gonna move on to respiratory. I'm just gonna kind of watch your breathing, and then we're gonna listen to your lung sounds.
Okay, thank you.
You're welcome. Sorry, I got the hiccups.
It's okay. I get them all the time.
So just noting, while I'm watching you sit here and breathe, you're not in respiratory distress. You're not cyanotic. You are a normal color.
That's good.
There, no use of accessory muscles that I can see. Your breathing looks unlabored and like you're doing just fine.
Yes.
So I am gonna go ahead and listen to. So I'm gonna feel your breathing.
Okay.
Just kind of have you breathe in and out to make sure you have equal rise of your chest. If I had a tape measure, we're gonna pretend that I do. I would measure your AP diameter, which is just a comparison of like front to back and side to side. It should be 1 to 2.
Okay.
So if I had a tape measure, I would measure literally from front to back and then from side to side, and it would be 1 to 2.
Okay.
So we're gonna say that you are because my tape measure that I have here says you are.
Okay, perfect.
Improvise. No thorax deformities noted. Chest rise, from what I can see, is normal. I'm just gonna have you take some deep breaths for me.
Right.
Yep.
Okay.
Deep breath. Symmetrical chest rise. My hands moving both sides at the same time. Go ahead and talk for me while.
Okay. Sure.
Yep. And vibrations are felt, so you're not congested and coughing a lot with me here. I'll listen to you, but from what I can see right now, there's no like fluid and gunk trapped in there.
Okay.
So now I'm gonna go ahead and listen to your. No, I'm gonna tap first. We're gonna feel your, percuss your lungs. Listen to what noise that gives us, and then I'm gonna listen to your lungs. And then while I'm back there, I'm also gonna assess your CVA angle. It's like your kidneys almost.
Okay.
So I'm just gonna press on that back there, and if you have any tenderness, let me know.
Okay.
We're gonna be checking your kidneys out while I'm back there. So starting with your front, I'm gonna go side to side about 7 times.
Okay.
Down your front.
Sure.
Tapping, and it goes in a ladder motion, so I go from side to side. Okay.
Okay.
Kind of just following the angle of your lungs also. Going side to side to make sure that, so I can compare the two.
Sure.
I'm gonna do your side, so I'm gonna have you lift your arm up over here for me, and I'm just gonna do like 3 times right here down the side, just kind of getting that. Okay? And then just gonna have you turn a little bit. Yeah, boy, yes, sorry.
Okay. Just before we keep spinning.
And then I'm going to have you kind of lean forward a little bit. I'm going to do the same on your back. About 5 times. I'm going to go down your back, 1 on each side, and I'm going to kind of alternate like in a ladder motion.
Okay.
All right, we're done with that, and now we are going to move on to the respirations, listening. Before I go to listening, I'm just gonna do the CVA tenderness, so I'm gonna feel back there. I go at your last vertebrae and your last rib, and I'm just gonna kind of poke around there. I'm gonna palpate lightly. Do you have any tenderness back there?
No.
Okay. What about on this side?
No.
No? All right, so your kidneys are great. There's no kidney issues that I felt.
Okay.
That's a little baby. Can I bring you down some?
Oh, just okay.
Are you sure?
Yeah, okay.
So Sorry, that's my baby. So now I'm gonna listen to the front. Just everything I just did with the tapping. We just hold her. Yeah, I'm sorry. Intermission, sorry. Hi. Mommy's trying to do her homework or something.
I've already tried.
You're gonna sit with Yaya?
Hi, sweetest.
Okay.
Hi, baby.
Sit with Yaya and be a good patient.
Okay, you're gonna do this with me. Ready?
Yay.
You say yay.
So I'm just gonna listen to you.
Sure. Here, baby.
Same as I did with the tapping, I'm gonna listen with this 7 about side and back. Okay.
Sure.
Take some deep breaths for me. Yeah. Isn't that cool? Okay. All right, Mommy's gonna have to sneak behind you. All right, last one. Deep breath. Okay, now lift this arm up for me. I'm gonna do the. Yeah. Okay, let's do this side. And now we're gonna do the back just like we did with the tapping, okay?
Sure.
Deep breaths for me.
Mm-hmm.
All right. I think that concludes our assessment. And now I'm just going to look over my notes really quick, make sure I didn't forget anything.
Okay.
Oops.
Do you have a good day?
Yes.
Okay, good.
Are you?
Yeah. Okay, great. Does that feel good? Do you have right here? What do you have right here? Ready?
So I would just tell you the Rothsing sign is you having pain. When I press in your right lower quadrant, you would get it in your left lower. It's just the pain referring to somewhere else. The obturator sign is pain at your hips when your knees are flexed.
Okay.
When I do that exercise with you, and the so sign is when the left leg, you lift the left leg against me holding pressure. And if you had pain, those are just signs that kind of relate that you are experiencing could be appendicitis.
Okay.
And then, like I said, Murphy's was for the gallbladder. Measured the JBP, about 6 centimeters is normal, and that has to do with fluid overload. You're not experiencing fluid overload. No ascites also in your abdomen. No ascites present. There's no fluid shift that was heard.
Okay.
When I was listening.
Mm-hmm.
The fluid shift that you can hear is a sign that there are ascites.
Okay.
No extra heart sounds or murmurs heard. I don't remember if I said that, but regular rate and rhythm +2 with all your pulses and your arms and your legs. Don't eat that. No swelling, edema, smooth skin, no discoloration of your skin on your arms or your legs, which would lead to make me think a vascular issue. I think that's a neuropathy.
I know. I was trying to do it.
No redness, swelling, ulcers, skin's intact, smooth. I think I got everything with your breathing. You had the regular rate and rhythm of breathing, your AP diameter. Yeah. I think, and then I would just describe to you the lung sounds that I heard.
Sure.
Vesicular is longer on inspiration when you breathe in than on expiration when you breathe out. They're soft and low sounds.
Okay.
Bronchiovesicular is about equal with inspiration and expiration. Your bronchial is longer when you breathe out than when you breathe in, and they're loud and high.
Okay.
And then your tracheal is about equal on inspiration and expiration, and those are also loud and high.
Okay.
And I believe that concludes our assessment. You
Awesome.
did wonderful,
Thanks.
and
So did your drive.
I'm happy you can meet my baby.
Say hi.
Say bye.
Say bye.
Bye.
I see you. Bye.